Hello and welcome to Salam, Namaste. Broadcasting live from the Now Media TV studios in Houston, this is Saji, Salam. This evening we have a very unique guest on the show, Dr. Sam Prasad. Dr. Prasad is one of the most impactful public health policy experts in India today. He's very much focused on HIV/AIDS and gender diversity and promoting the concepts of gender equality in India. Dr. Sam Prasad, welcome to the show.
Thank you, Saji. I think it is a privilege and an honor to be here. And thank you for taking this forward. It's so good that the timing is perfect because why December 1st we are going to observe the World AIDS Day. So probably we need to talk more.
Right. Thanks, Sam, for taking the time to join us. Let's dive right into this. So I would start out by asking how you got into or got interested in the field of public health after your medical degree.
Well, that's a long story, but then I think it's not, by accident that I'm here. I was actually, interested in voluntary work even while I was doing my medicine. And then I got involved in HIV work as early as a first year medical school graduate, when I was reading my first year itself. And then I volunteered with some of the organizations. One is that we do have the Kerala State AIDS Control Society, and I was a family life education trainer, and my exposure to HIV started like that. But then later I was exposed to conflict resolution management peacekeeping through the IFOR, which is International Fellowship of Reconciliation, a Netherlands-based organization which came in to India and then started talking about peacekeeping and all that. I was placed in Vavuniya for some time and got trained into peacekeeping and all that. But it was in between some very fierce battles that was happening. Those times, if I could remember, brings chills down my spine. Thinking about how we were doing it. But later, I understood that, the public health is in this incarcerated or conflict zones is something that needs to be attended to. And then I devoted actually my entire training and exposure to public health, and I never taken a look back at, really doing clinical practice as, we all expect, Dr. Saji, because, that's where, one is to be placed. But then, community health as as a faculty, as a domain, needs much more people.
Oh, that's so great that you've moved into the sphere of public health. And while you moved into public health, I think did you do some work with some other international organizations as well prior to focusing on HIV/AIDS space in India?
Absolutely. As when I graduated, the very first thing was that, as a young graduate, people expect a medical doctor from India to be practicing, right? So I tried my hand at, practicing in different places. And then I understood that that's not my calling, basically, to come out and then, do with my skills, my networking abilities and all that. So I thought I should best put, that kind of efforts into public health. And I joined one of the medical colleges as a lecturer, as a junior professor in community medicine. And this is the year was 2004, and that's when the tsunami hit. In fact, while we were there, we were affected also in the state of Kerala, Tamil Nadu, we were affected, as you know. So that time, I was posted in managing the tsunami affected areas from day one onwards. And this was a big challenge. I mean, this was unprecedented. I didn't even know the spelling of tsunami. I mean, most of us didn't know what a tsunami is unless, you're affected by that. So it all started like that. And then I was offered a placement by UNICEF after looking at our initial days activities in this field of, the tsunami-stricken areas. And then I joined the UNICEF as the focal point for Kanyakumari, which is like the down south tip of India. And from there, my career started off with public health, and I was trained in UNICEF. I was trained in that project. Later, I joined the USAID program. It is called the APAC, which is AIDS Prevention and Control project. And then I took another turn when I joined the WHO, and I was part of the polio eradication program of India, and it's called the NPSP basically. And then those assignments placed me to get an exposure at the ground level. And I was in Western UP, Uttar Pradesh of North India. A person from South, right from Kerala, placed in North India is a great, exposure. Even the language is different, as you know, Saji. So Hindi-speaking territory, and then the culture, everything was different. But then those challenges actually kind of, I would say, polish my skills and also to, anchor myself more into public health. So that was the journey that I took in the domain of public health.
Mm-hmm. Great track record, and a good segue into talking about what you currently do as the country program director for AHF India.
It's AIDS Healthcare Foundation. So again, we are a 35-year-old organization, 45 countries spanning 45 countries with services. We're the largest HIV organization in the world. It's based out of Los Angeles, and the headquartered in Los Angeles. But then we do definitely work in 45 countries. One of the greatest things is that this is the largest HIV organization. When I say that, we are catering to 1.9 million people living with HIV and the population surrounding the sector in 45 countries. And then that was a great opportunity for me to get into the service of HIV/AIDS, and then I'm continuing my service with this AIDS Healthcare Foundation. In India, we are registered as India Cares, and that's why on the branding you would see AHF India or AHF India Cares.
Mm-hmm. Great to know more about AHF. And so now let's go a little deeper into the subject matter itself. So could you speak a little bit about the prevalence of HIV in India and some statistics, and what do you feel about the overall scenario here with HIV/AIDS?
Absolutely. I'll start probably with some fact sheets about the global HIV prevalence itself. We know that all over the world we have around 39 million people estimated to be living with HIV in the year 2022. And out of that, around 1.3 million people became newly, this is an annual infection rate of 1.3 million, getting newly infected with HIV in 2002. So, many people, when we have discussions say that, HIV is a 40-year-old or a 35-year plus, epidemic. I thought it was over. But then we are talking about 1.3 million people newly infected with HIV in the year 2022. That brings us to the focus on, how to, design interventions across it, and also to, not to be complacent. At the same time, the death rates, if you look at it, almost 700,000 people died from AIDS-related, illnesses in the year 2022. So, out of this 39 million who are globally living with HIV, we only have around 29.8 million people accessing ART treatment, which is antiretroviral therapy treatment. With a gap of around 9 million plus. We are still staggering. We are at the low level of the services, I would say. But there is a considered effort saying that by 2030 we should be able to reverse the epidemic. That being said, about the global scenario, if you talk about India, we are estimating that we have almost around 2.4 million people living with HIV in the country, and then these are not. Statistics, per se, but then, this is by experience of looking at the central surveillance system that we have. And also we have done HIV prevalence according to the populations that it is getting affected. So we have something called the ANC, which is antenatal clinic prevalence. which is 0.22 percentage. Antenatal clinics, as in pregnant mothers, when they visit the clinics, they get HIV testing, and that's a surrogate indicator for, probably, looking at the country as to where we stand. But also in incarcerated settings like prison inmates, we do have a prevalence study of 1.93 being found out in the year of 2021. The core group, as we call it, is female sex workers, men who have sex with men, as we call it, or the LGBTQI community, one part of the LGBTQI community, which is MSM. And then we have the injecting drug users. For the female sex workers, it is 1.85% prevalence compared to, 0.22 with the ANC. So much higher prevalence right there. And also for the MSM, it is almost around 3.26%, which is according to the NACO, National AIDS Control Organization's reports. The IDUs, or the injecting drug users, have a very high prevalence, as we know that the transmission is very quick because there is an exchange of fluid, exchange of blood, and also sharing of needles, which is happening in this community because, they can't they'll save up the money to buy drugs and not take care of themselves. So that way, the prevalence among the IDUs, as we call them, the injecting drug users, is very high, 9.03%. Whereas, under the LGBTQ umbrella, we have talked about MSM, which is the men who have sex with men, or usually, we don't use that word, you call them as a homosexual community. But then we also have the Hijra, or the transgender community, as we call it. They are having a very high prevalence of 3.78%. There's two other populations which are, again, highly vulnerable. One is the single male migrant population. As you know, India is a robust economy. I mean, we are booming in, and then we have a lot of construction happening. We have a lot of expansion of cities happening where migrant workers throng from different parts of India towards metro cities like Mumbai or New Delhi or, Chennai, etc. So they are having a free time. They have having disposable income, and also they have in close contact with sexual networks. So that makes it very, highly vulnerable, and they almost reach around 1% prevalence.
Oh, thank you for the overview of HIV prevalence in India, Dr. Prasad. We'll be back after a short break.
Sure. Thank you so much.
What if you could feel in control of your retirement in just a few clicks? At aceyourretirement.org, you can. Start with a free 3-minute chat with Avo, your friendly digital retirement coach. Just answer some simple questions like, how do you feel about your ability to save for retirement? Or in how many years do you want to retire? To get free action items customized just for you, get your retirement back on track at aceyourretirement.org.
Okay, Dad. 1, 2, 3. You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
You are loved. You are valued. You are resilient. You got this.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
There's so many rewards in life. You coming into our home was one of the greatest rewards we could have ever had.
It took 20 years, and I got my third child, who was 17 at the time.
It's so cool to watch the adult that you've become, and you really have done as much for us as you think we've done for you.
Welcome back. Let's continue this conversation with Dr. Prasad. Dr. Prasad, we talked at a high level the HIV prevalence in India. Let's dig a little deeper into some of the other aspects around this. Maybe talk a little more about gender in HIV, and which genders are you seeing HIV? Some of the social factors. Could you touch upon those?
Yeah, absolutely. I mean, as I said, we are looking at the people living with HIV as a 2.4 million estimated, but 1.05 million out of this is actually women, 15 plus years of age as we calculated. And then, if we look at, the percentages, it's almost coming to 40% plus. So, women are disproportionately affected, but at the same time, the service, if you look at the service, women are the one who actually has the opportunity to go and get the services. As I said before, like, ANC, antenatal clinics, definitely when a woman is pregnant, there is a system that, there is screening for HIV, VDRL as we call it, for the STIs and all that. So, they have better chance of, going into, HIV testing and also to care. But then what is happening in the rural communities also, that there is inaccessible areas in our country and also the countries of the global south, in total, where access to HIV testing is a big problem. So, that's why I said, women are disproportionately affected. Added to that is also the stigma that, many things culturally also, like, for example, at any given point in the world, there are around 800 million people or women who are experiencing their monthly periods. Why am I bringing periods here? Because there is a dearth of a staggering 500 million individuals lacking access to essential menstrual health facilities and practices and products. So that is one of the things that keep them away from the schools, unable to complete their education, etc. So it is, again, affecting, socioeconomic factors, and even menstrual health affects, women to be empowered and then take decisions for themselves. Likewise, in India, we have a disproportionately affected, women population, and also look at those women who are at home and not, working, or, housewives, as we call, homemakers, as we call them. They don't have the access to, kind of do HIV testing unless they are pregnant, So when we looked at, one of the population that I was talking to you was also the single male migrants. And when the migrant population goes back to their homes, if they have had an infection, there is a likelihood that, these infections might be transferred to these women who have never left their homes. That way, that brings in the gender, disparity there, and then the vulnerability of the women increases. So that way, we need to have, gender-oriented programs there. Expanding beyond the scope of women, if you come to LGBTQI populations, I've already discussed about, the MSM population or the transgender population having very high vulnerability. They indulge in, homosexual activity and also unprotected homosexual activity. So the death of condoms, for example, as a preventive tool, we call it as the little thing, little small thing. But then, that the inaccessibility of those condoms are actually putting them at high risk and vulnerability. That is why we get an MSM population vulnerability, or the prevalence, as 3.26 compared to 0.2 or 2.1 or 2.2 as a ANC prevalence. Added that is also the stigma around homosexuality. With the, I'm sure you know that the Section 377, of the Penal Code, the Indian law has been repealed now, giving them more freedom, and then not criminalizing same-sex, interactions. That has made the population of MSM to come out in the public, but then also to access testing, also to have condoms, access to condoms, and also not stigmatized by the general community is the need of the hour. So that way, transgenders and the other population, like the MSM, also are vulnerable. So there are different lines of, interventions that we need to cater. That we need to design to cater to the service of this population.
Interesting conversation, Dr. Prasad. What about sex workers and HIV? Is that something that we need to address as well?
Absolutely. I mean, there is a vertical program which is called the FSW program as part of the, the Targeted Intervention Program of NACO. And across the world, FSW, as we call, or the female sex workers, or the women in sex work, as we call them, is a targeted population and the most one of the most vulnerable populations, especially from when you look at it from the gender angle. So definitely, we need to access, make access to services more accessible to them. We need to have peer educators who are from the community who can actually go in and then educate and re-educate them from time to time. We have to look at increasing the accessibility of condoms to them, making them available, and also whenever needed, if there is any person who is HIV positive, to bring them into the service hall and then give them the services of antiretroviral therapy. The antiretroviral therapy, when it's adherent, or when the person is adherent, even if it's a person who is from the FSW community, actually takes care of the further transmission of the virus, and it's called TASP, treatment as prevention. So all these services which have to be directed more towards the female sex workers.
Mm-hmm. So apart from these categories we discussed here, are you seeing prevalence among the general population increasing, though, and how much of that is being tested currently?
Absolutely. I mean, we are in a way seeing a lot of general population prevalence. While I talked about the core group populations and the bridge populations, like the single male migrants and the long distance truckers, we should just look at who are the clients of these people, from the core group and the bridge population. There is a usual, pretext or thinking that, these are the vulnerable communities and they are the ones needs to be taken care of. But the fact of the matter is that the clients are the general population of any country, any region, any district or any state. The clients are from the general population for these core and vulnerable or the bridge population here. That is where, we need to look at accessing or giving the access of testing of condoms to the general population, as we call it, as the high risk population from the general population. So identifying them is a big task. Nobody wants to talk about HIV, or nobody wants to talk about, other, as we call it, as, beyond the scope of marriage, having sex with any gender or, anybody there. So that brings us into a big challenging situation there too. But the general population trend, as we see here, for example, in India, there are many states and new pockets emerging where the general population is having more HIV prevalence than the core group itself. Okay. That's a big alarming situation. So we call it as a generalization of the epidemic, or the epidemic moving into the general population. That's the scary part, basically. Okay. And that gives us the onus to design programs in a non-stigmatizing manner, so that they can access the HIV testing and HIV services. If you know that you are a high-risk taker, one has to just approach the service providers and then look at the opportunity to detect that, or do the testing and detect the presence of the virus if you have it, or take the steps like, using condoms at every interaction on a sexual encounter. So that way we are seeing a lot of rising trends in certain pockets of the country and also in the world. But then we need, that brings us back to, doing more programs for the general population.
Okay, very interesting perspectives here, Dr. Prasad. Let's talk more about some of the interventions that you do in India after this commercial break.
Sure.
What if you could feel in control of your retirement in just a few clicks? At aceyourretirement.org, you can. Start with a free 3-minute chat with Avo, your friendly digital retirement coach. Just answer some simple questions like, How do you feel about your ability to save for retirement? Or in how many years do you want to retire? To get free action items customized just for you, get your retirement back on track at aceyourretirement.org.
Okay, Dad. 1, 2, 3. You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
You are loved. You are valued. You are resilient. You got this.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
There's so many rewards in life. You coming into our home was one of the greatest rewards we could have ever had.
You know, it took 20 years, and I got my third child who was 17 at the time.
It's so cool to watch the adult that you've become, and you really have done as much for us as you think we've done for you.
My name is Andrew Glisson. Over the past 4 years, I've built a portfolio of over 200 single-family rental properties that generate over $200,000 a month in income. I've put together a 6-step formula to help you consistently acquire rental properties that cash flow $250 or more a month and have $30,000 or more of equity built into them. This includes starting right, becoming bankable, buying right, renovating right, exit strategies, property management, and many more modules. Best of all, if you're not totally blown away by the content, we offer a 30-day, no questions asked, money-back guarantee. If you're ready to build generational wealth for you and your family, look me up at sfruniversity.com.
Hey, Lily says AT&T is giving everyone their best deals.
Minus the air quotes.
Best deals.
No need to wink. Others say they give everyone a deal, but not everyone gets the best deal.
Told you, the best deals are for everyone here, with a choice of plans.
You were right.
Is she always right?
Always.
At AT&T, we give everyone our best deals on every smartphone.
Are you a business owner feeling overwhelmed or burnt out with no energy left for what's most important to you? In order to effectively run your business and maximize your profits, you have got to be the best possible you that you can be. Now is the time to reclaim your energy, master your schedule, and maximize your profits so you can effectively run your business rather than it running you. It's time to become the CEO of your business and life. I'm Jen Godet, a business strategist and life coach. I work with overwhelmed business owners who feel stuck in a rut and depleted. I teach you how to stop doing the things that aren't making you money and start prioritizing the things that bring you energy, joy, and lasting impact. I'm a human performance specialist and an international best-selling author. I've helped countless people all over the world to learn the art of saying no, overcome their fear, and maximize their performance. Let's get you to live your best possible reality. Start today and become the CEO of your business and your life.
Taking a trip in the next 12 months? Airlines are under tremendous pressure and they're practically giving away their unsold seats. Like every crisis, this one will end too. But right now is the best time to take advantage of giveaway ticket prices on their unsold seats. We're not allowed to publish these low fares online. The only way to get these rock bottom giveaway prices is to call. So phone low-cost airlines now for airline ticket prices you may never see again.
been a fascinating conversation so far with Dr. Prasad. And as we delve deeper into this, let's talk a little bit about the innovative interventions in HIV prevention that AHF and your organization is doing in India. And to lead you into that, let's talk a little bit about the usage of condoms in India and some of the structural / cultural barriers in adoption and what you're doing to address those concerns.
Absolutely, Saji. I'm very happy to say that, AIDS Healthcare Foundation is one of the is the leading organization, I would say, in innovations, like bringing in behavior change through innovating and providing non-stigmatizing environments, and then bringing down the stigma of condoms. So as you see on my right and left, we have this mannequins draped with condoms. You must be wondering, I don't know whether that was very clear in the camera, but then these are condoms, like these are condoms, and then these are fashion, kind of apparels made out of condoms. And also on the left side, you can, on my left, you can see that too. But at the same time, let me also introduce this little person here. So what we are trying to do is bringing down the stigma on condoms, and then talking about condoms in many platforms, like, in the social media, even in mass media, in the newspapers and things like that. So we came out with something, the very first, thing that we did is we came out with a very non-stigmatizing or a very non-discriminatory name like Love. So I have Love condoms here, which are made by us, made by AHF. These are designed by AHF. This is designed by in-house, and then it comes in packets like that, in attractive packets like this. These are free for distribution to anybody, any organization, individuals, etc. Also, we do have these puppets, which are to be held like this in both hands, and then we have youth dancing onto Bollywood, or even the latest from the music world, and then trying to showcase them as a very non-stigmatizing, that to bring down stigma, that we need to kind of talk about that. We also do have dispensers like this. These are condom dispensers. These are free, and these are kept in places like corporate offices, in public, wherever there are NGOs, in public spaces many times, and then people can just pull out, you just have to put your, just pull out like this, it's free. So these are all Love condoms, free for distribution, and then thereby, trying to bring down the stigma. We also try to kind of, put in, because the social media is so high with sexting, texting about sex, So we do have the eggplant mostly used in social media, as well as in, in networks, sexual networks across the internet. And the eggplant is used as, often like a smiley, like a, emoji or emoticon, like that, and then they talk about sex. What we, our global office, from the marketing department and from our global office, we came out with something like this. This is as you can see, it's a pin, but now we are saying that the world is ready for a condom emoji. So innovations like that, and then the eggplant is there, but then it's covered with condoms. With a condom. So that way, we are bringing in, efforts. Our efforts are there for bringing in newer, variety of, innovations, or, to be in tune with the, youngsters. We bring in these kind of interventions and also designs, wherein, we have some other props also. I can show you that, this is like a prop. It's like a dog tag, as we call it, and then people wear it. There are keychains and stuff like that, which says condoms are cool, And then this, what are we trying to say here? We're trying to say that condom, as we know, is as we call it, as a poor little thing, which can actually the cheapest form of preventing HIV or other blood-borne diseases or body fluid, where the transmission can occur through body fluids. And that little thing is actually ignored, and that little thing is really stigmatized and kind of sidelined. We want to bring in back the focus onto condoms and then talk more about condoms. These two mannequins that are draped with these condoms, these are dry condoms. As you can see, these are condoms here. And this is an effort to kind of involve the youth. What we did is, as an innovation, what we did is we sourced the dry condoms before the gels are put in, and then we gave that condom boxes to the students of colleges in the country, across the country, and also some of the fashion management institutes were also called in, and they did make it as a competition where the students were required to make designs and then display that in the Central Park of New Delhi. And we came out with stunning designs, as you can even see that. And then the students were so much involved and said, Dr. Sam, this is something that we would love to do, and this is such a non-discriminatory thing. But then, our probably the earlier generation has to be sensitized more as to talk about this freely. So that's advocacy there. That's the youth advocating for condom use to the elderly society or the elderly population of the country. We also did a very successful campaign and still running. It's called the first free online condom store in India. First free online condom store in India. All that you have to do is that you do a call on this number. This is a toll-free number here. I don't know whether you can see this, but then this is the toll-free number, 1-800-102-8102, or send a mail to us on free condom store online at gmail.com, and then it comes in as as a request. What we do is we have pieces of condoms coming like this, 144 pieces of lubricated love condoms. What we do is we ship it to the people who request condoms like this, like a Flipkart packet. It doesn't show anything about it. It doesn't talk anything about condoms, but onto your preferred location and an address, we ship it. I would want to say this, Saji, very emphatically, that we started off this initiative from after inauguration from our global advocacy chief and all. They were all here. We started off, with a stock of 1 million condoms. 69th day, we kind of, finished our first stock of 1 million condoms. And we have, as on today, while I speak to you, I think we have around 3,000 mails pending to be, sent with condoms. This is, it's such a big need is what is coming out of this, and also an innovative program where you don't have to talk about. We don't want to know who you are. We don't want to know your age. You don't want to have your national IDs, but then just tell us that it's going to be personal use, because it's already said that it's free for distribution here at the back. And then say that, okay, it's for my personal use, or I can give it to my community, or through any CBOs or NGOs, community-based organizations, or non-governmental institutions. So, of course, as you see it, 1-800-102-8102 on the screen, yeah. And you can order condoms from any part of the country, and then this effort was to make access to condoms and also to bring down the stigma of condoms in India. So these are various ways of doing this. For the MSM community, we do also have, another design, very attractive design, because they like the colors and all that. So we have things like, condoms being shipped to the MSM community also, or the transgender community. So we support these organizations. Whoever is writing to us, we can, give them the condoms and then popularize condom use in India.
Very, very good initiatives there. Dr. Prasad, can we talk a little bit about the testing aspect of this? I keep hearing about the rapid testing program and the Moonlight testing program. Could you speak to that?
Absolutely, Saji. So I'm glad to say that the current testing model that we have in India with AHF India Cares is called the duo testing. This is as simple as it. You don't have to have a big lab. I don't know whether you can see this. Yeah, this is just like our monitoring our glucose levels, like with a one prick. There's a lancet as small as this, a very minute microscopic needle here, which you can, prick your fingertip with. Take a drop of blood, put it in this well of this test kit, and then in 15 minutes, we get the results. Gone are those days, Saji, when we used to be, in our medical school days, we used to have big needles being stuck into our veins, and then, blood drawn as to 10 ml or 25 ml or whatever, and then we had to wait for the results for 3 to 4 days. This gives results in 15 minutes. So that makes it more important, or very, very easy access to, design programs like community-based testing. So what we did is we formed organizations like, CBOs and NGOs. We collaborated with them and then said, okay, we need to identify certain areas, high-risk zones, as we call it, or where the conglomeration of this high-risk sexual networks are there. Go there and then, appear through the education, through IEC, information, education, communication, mobilize the people in that community, and then do HIV testing. So it's like, they don't have to wait for the whole day. They don't have to lose their wages for that day, or if there are laborers, they don't have to spend a lot of time there. It's just 15 minutes and there you go. And this is also that, there is 2 tests here, one is HIV and the other one is syphilis. And, because if you have syphilis, there is definitely a chance that, it makes it more vulnerable for you to kind of, get HIV. On the other way also, like, if you have an HIV already, probably there is a chance that you could also be harboring an STI. So that's something like that.
Okay.
But then at the same time, you talked about moonlight. What is moonlight? Moonlight is nothing but an abbreviation for mainstreaming out of network laymen, intersexed or injecting drug users, LI, GHTs, gays, hijaras, and transgender. So it is mainstreaming these communities. Okay. What do I mean by mainstreaming? During the day, the services are all open from the government centers, and then when they close it down, that is when actually the sexual networks become very active.
Okay.
And as we know, by the evening hours, all the sexual networks, come into play, and the sexual activity happens during the night. So what we devised is that, we would go into public spaces, parks, or maybe interstate bus terminuses, or wherever people conglomerate along with the sexual networks. We go there and offer them the HIV test kits, like HIV testing through this small test kits. And that's why we call it as moonlight. And this extension of this service is from 6:30 in the evening till around 11:30, 12 in the night. And then we converted our clinic part. The clinic also was moved in, shifted the time with one team addressing this clientele that we are getting from the moonlight testing. So that way, moonlight testing and moonlight clinic. And we have been getting astonishing results. 100 tests, or 15 people or 13 people, getting positive in a single day. So that way, this moonlight testing has been a great success. It has been now, taken up by some of the state governments of India, and also some of the, in some other countries also, this has been proved as one of the need for the country, need for that country, because, as we know, during the daytime, the services stop, but then taking those services into the night is something that definitely would aid in getting more identification of sexual networks and more people who are, vulnerable to HIV and STI.
Thank you for educating our viewers on all these programs that you're conducting in India. We'll come back after a short commercial break.
Sure.
My name is Andrew Glisson. Over the past 4 years, I've built a portfolio of over 200 single-family rental properties that generate over $200,000 a month in income. I've put together a 6-step formula to help you consistently acquire rental properties that cash flow $250,000 or more a month and have $30,000 or more of equity built into them. This includes starting right, becoming bankable, buying right, renovating right, exit strategies, property management, and many more modules. Best of all, if you're not totally blown away by the content, We offer a 30-day, no questions asked, money-back guarantee. If you're ready to build generational wealth for you and your family, look me up at sfruniversity.com.
Hey, Lily says AT&T's giving everyone their best deals.
Minus the air quotes.
Best deals.
No need to wink. Others say they give everyone a deal, but not everyone gets the best deal.
Told you, the best deals are for everyone here, with a choice of plans.
You were right.
Is she always right?
Always.
At AT&T, we give everyone our best deals on every smartphone.
Are you a business owner feeling overwhelmed or burnt out with no energy left for what's most important to you? In order to effectively run your business and maximize your profits, you have got to be the best possible you that you can be. Now is the time to reclaim your energy, master your schedule, and maximize your profits so you can effectively run your business rather than it running you. It's time to become the CEO of your business and life. I'm Jen Godet, a business strategist and life coach. I work with overwhelmed business owners who feel stuck in a rut and depleted. I teach you how to stop doing the things that aren't making you money and start prioritizing the things that bring you energy, joy, and lasting impact. I'm a human performance specialist and an international best-selling author. I've helped countless people all over the world to learn the art of saying no, overcome their fear, and maximize their performance. Let's get you to live your best possible reality. Start today and become the CEO of your business and your life.
Taking a trip in the next 12 months? Airlines are under tremendous pressure and they're practically giving away their unsold seats. Like every crisis, this one will end too. But right now is the best time to take advantage of giveaway ticket prices on their unsold seats. We're not allowed to publish these low fares online. The only way to get these rock bottom giveaway prices is to call. So phone low-cost airlines now for airline ticket prices you may never see again.
What if you could feel in control of your retirement in just a few clicks? At aceyourretirement.org, you can. Start with a free 3-minute chat with Avo, your friendly digital retirement coach. Just answer some simple questions like, how do you feel about your ability to save for retirement? Or, in how many years do you want to retire? To get free action items customized just for you. Get your retirement back on track at aceyourretirement.org.
Okay, Dad. 1, 2, 3. You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
You are loved. You are valued. You are resilient. You got this.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
There's so many rewards in life. You coming into our home was one of the greatest rewards we could have ever had.
You know, it took 20 years, and I got my third child, who was 17 at the time.
It's so cool to watch the adult that you've become, and you really have done as much for us as you think we've done for you.
Welcome back to the show. Let's continue this amazing conversation with Dr. Sam Prasad. Let's jump to a little different topic now, Dr. Prasad. Let's talk briefly about the HIV and tuberculosis connection.
Absolutely. I mean, with HIV, the most commonest OI, as we call it, the opportunistic infection, is TB. Why? Because HIV affects the immunity, and then, the TB is much prevalent in many settings, especially the urban slums or even in the rural slums and areas like that where density of people are very high, and then there is a lot of transmission. But, the best part of it is that TB is a completely curable disease. We have the most modern, multi-drug therapies. We have the multi-drug resistant strains also, but then still we have therapies and we have medicines to kind of do away with TB. So it's a completely curable disease. At the same time, anybody coming with TB is screened for HIV. Anybody who's coming with HIV is also screened for TB. So that makes it really complementary and then get things going. At the same time, like countries like India or countries like, where there is a highly dense population in the rural slums or in the urban slums, it is very necessary that active case finding has to be done for TB. Otherwise, we are going to be having a lot of cases which are undetected or, lost the opportunity to kind of, worked up and treatment to be given, leading to multi-drug resistant tuberculosis or even extremely drug-resistant tuberculosis. So there is a clear link to immunity, and then the opportunistic infection most common in HIV is TB.
Great to know about those interventions and the co-infection with HIV and TB being addressed effectively. And in this regard, maybe could you speak to the interventions you do on truckers in India?
Absolutely. Truckers and male migrants are part of the vulnerable or the bridge population, as we call it, and long distance truckers. Why? Because they're out on the road for many months altogether, many weeks altogether. They'll be shipping from the northern part of the country down to the south. They might be waiting for cargo to be loaded onto their trucks. But when they go back, as they have to travel a long way, they often have money, cash with them, and they have disposable time also. The sexual networks of those areas, wherever they travel, they know that these are people who are interested in sex and also away from homes, and they wouldn't have had sex for a long time, and they also have money with them. So that's the nexus between the sexual networks and the truckers, which makes them very highly vulnerable to contracting HIV, STI, and other diseases. What we do is we work with, for example, the Varuna, which is a logistical company. There are many truckers associations. We work with them. We sensitize the drivers. We sensitize the hamalis, as we call them, or the support staff of the truckers, the trucking community itself. We sensitize workshops. We sensitize laybys. We sensitize people who are in the toll booths of the boundaries between states. We give them condoms and say that display the condoms so that they can access that. So, and also we do the HIV testing for them. So they are very vulnerable population, and truckers, post COVID, as logistical, companies have been booming. That's become a big boom, and a lot of fleets and fleets of trucks coming out, and then a lot of people getting employed. But we are trying our best to kind of, partner with them and then partner with these companies and then, stop the spread of HIV.
Okay. Well, that's a very, very smart, targeted intervention, I should say. This is very interesting to learn about that. So now let's talk a little bit about the global aspect of HIV. And I'm aware that your organization recently conducted a conference or meeting with several parliamentarians across the world. And what is the idea behind it, and then how is that transferring this body of knowledge that you have gained from working in India to other developing countries?
True. Word is right. There's a interparliamentary, forum called the Unite. Unite is nothing but a group of parliamentarians from across the world who are working for community health. And this is a brainchild of Dr. Ricardo, who is from Portugal. Is himself a member of the parliament. And then when he moved to this idea, AHF was the very first. Our president, Michael Weinstein, was the very first one to, lend a hand and said, okay, AHF is going to be working with you. And then it began very small, but then now they're spanning over many countries, a lot of parliamentarians, MPs, member of parliaments, being part of it. Many of them are activists, many of them are politicians, and also doctors. Many of them are doctors in that community. We were very fortunate to have the board meeting, the annual board meeting of Unite to be hosted in India, and through a delegation that came down to India from one of our Rajya Sabha MPs, esteemed, Amar Patnaik ji. He was a focal point for India and the chair of Unite India. And we were able to sort of, showcase the services that we are doing at our clinic, and they visited us, and then. When I say small, we are just 2 clinics, in India. But then also that we are making this progress and how to do the model advocacy and then get this thing out to the decision makers of the countries. But also at the same time, I would also want to, talk about Forum of Parliamentarians on AIDS. It's a big, was a very robust platform of parliamentarians in India, and we used to support. As the AHF, India Cares, we used to support the parliamentarians in taking, decisions and, bringing in the discussions in the parliament to keep it alive. And then, sensitize those people in the parliament to take the policy decisions which are good for the country. Now, we are with this infused new energy that has been infused through the Unite. We intend to take it forward further and, strengthen the Forum of Parliamentarians, and on HIV/AIDS, and then keep the discussion going in the Parliament. And I think, that's going to be, a very good way of, bringing in new policies, people-friendly policies in our country too.
Thank you. Dr. Prasad, that was a fascinating conversation about the work that you do and the impact that you are making in the field of HIV prevention and policy making in India. It was great to have you on the show. And to our viewers here, we'll be back same time next week. Thank you for watching.
Thank you so much, Dr. Saji.
This has been a Now Media Networks feature presentation. All rights reserved.
What if you could feel in control of your retirement in just a few clicks? At aceyourretirement.org, you can. Start with a free 3-minute chat with Avo, your friendly digital retirement coach. Just answer some simple questions like, how do you feel about your ability to save for retirement? Or in how many years do you want to retire? To get free action items customized just for you, get your retirement back on track at aceyourretirement.org.
Okay, Dad. 1, 2, 3. You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
You are loved. You are valued. You are resilient. You got this.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
There are so many rewards in life. You coming into our home was one of the greatest